Hi everybody, I'm John Linkous. Welcome back to This Month in Telemedicine. I'm going to give you updates on a few things that are going on, and later Gary Capistrant, I think he's out groundhog hunting right now. He'll be back in a little bit to talk to us about what's going on Capitol Hill. Well, we just completed our annual conference, Telehealth 2.0, and I'm really glad to announce it was a great success. We exceeded last year's number in attendees. In terms of our registered attendees, people who attended all of the educational programs and the other sessions, we broke a new record. So it's a great thing, and this year associations, a lot of them aren't doing so well. I'm really glad to announce that ATA really is doing well, and we're really growing. I want to welcome a lot of new members that came to the meeting. We had an overwhelming number of people who was their first time at the conference, which is a good thing for ATA, but it really says a lot about where telemedicine is growing. We had a number of things that were exciting and new this year. And if you talk to someone who was at the conference, I hope that they give you a little bit of the excitement. We trended this year again in tweets, for those of you who are into the Twitter. And we had some really superb presentations. We had Pamela Peel from UPMC, Patrick Kennedy, Thomas Friedman, the author, and a panel of really interesting corporate investors. We also had hundreds of presentations in our concurrent sessions. We had 3 spotlight sessions that were packed this year. They talked about the future of online consultations, scaling up in terms of the health systems that are moving up in terms of their use of telemedicine, and an Inspiring Women in Telehealth panel, which was a really fascinating one. Let's take a quick peek at that panel.
Making it better. Madeleine Albright, former Secretary of State, has a famous phrase, "There's a special place in hell for women who don't help other women." And I second that motion.
Also at this meeting, we announced this year's Humanitarian Award, which went to the Santana Telemedicine Project. The award recognizes institutions and individuals that use telemedicine to reach out and improve the lives of the poor and underprivileged in other parts of the world. And you know, I consider this a very special award because it represents the fact that telemedicine is an industry with a heart. It's not just information technology, it's not just devices, and it's not just providing an ROI or reducing costs or expanding markets. All of those are very important, but it's really about helping patients in the end. And anyone who's involved in telemedicine, you can see right away that the interest that they have is more than just a business. It's really a business making a difference. So I finally say about the conference, all of the presentations, the plenary sessions, and all the hundreds of breakout presentations are going to be available online through our Learning Center. Stay tuned. In a couple of weeks, they'll all be available up there for you to take a look at and purchase if you want to get the package. Thanks. Also at this year's annual meeting, we welcomed ATA's new board leadership. Dr. Peter Yellowlees, who's at UC Davis, comes in as our new president this year. Dr. Andrew Watson at UPMC in Pittsburgh is our new president-elect. And Christy Henderson, who is at Seton Health in Texas, comes on as our new vice president. Our treasurer is Alexis Gilroy from Jones Day, and our secretary is John Glasser from Cerner. Great group of people, and all of us on staff really look forward to working with them. We also have a couple of new board members, Dr. Bart Demarchek, who is the medical director for telemedicine at the Mayo Clinic, and Christopher Northam, who's vice president for telehealth at HCA. We got a great board of directors, but the one thing, sad thing, is that we have to say goodbye to Reed Tuckson and Roy Schoenberg, who is going off the board this year. They've done tremendous service for ATA, and I hope they'll continue to work with us here at ATA, but they also had a great contributions while they were on the board. Coming on as immediate past president, of course, is General James Peake. And I want to take this time to thank you, Dr. Peake, for all the things you've done with ATA. Personally, it's been a great learning experience for me as we kick it up a notch in the association. And you've been a great leader for us, and I know you're going to continue on the board, which is wonderful, but just a special thanks for all that you've done. Also, I want to give you an update about the future of ATA, the American Telemedicine Association. You know, it's been an interesting, I think, transition year for the association. We're in a time of transformation for telehealth. It's not like it was when ATA was formed 22 years ago, of course. And ATA is going through our own transformation. It's really been fun. It's been exciting, but it's been a whole lot of hard work by the staff and the board. We've come up with a 5-year strategic plan, which is now available on the website under About ATA. We have a lot of projects and programs that are coming in, a lot of work to bring in the membership to a much stronger network of people who will be contributing to the future. A lot of interesting projects coming up as I think we're going into a new age with all of the remote use and some of the new technology and some of the new services, but the increased interest in adoption by payers, by regulators. It's kind of overwhelming for those of us who've been around for a while, but it's really a lot of fun. And take a look at the strategic plan, give us some comments, some thoughts if you want, and we look forward to all of that. Now, coming up in just a minute, Gary Capistrant has come to us and will be giving us a brief on what's going on in the nation's capital.
So up on Capitol Hill, we got a lot of groundhogs popping up. They all have telehealth bills around their necks. We've got lots of activity about telehealth bills. On the Senate side, there's just been the reintroduction of the Connect for Health Act. This is the leading telehealth proposal. It was in the previous Congress. It's been improved and been reintroduced. It will be reintroduced in the House soon. This has the support of over 100 organizations. Importantly, on this and some of the other bills that I'll talk about, what you can do is help with co-sponsors, to talk to your 2 senators and the representatives that are either your district, or if you're a hospital system, that the congressional people that represent the hospital system, or if a company, but to reach out to yours and to indicate the importance to them. In addition, the Chronic Care Act has been reintroduced. This is S870. The Connect for Health Act that I had just mentioned, we don't have the bill number. I would have given that to you. But by the time you view this recording, the bill number will be there, and we'll have covered that in our news. But the Chronic Care Act, this was the work product of Senate Finance Committee leadership. The committee may take action yet this month on, again, S870. That bill does 4 important things for telehealth. It would include telehealth for Medicare Advantage plans that cover about 1/3 of the beneficiaries, accountable care organizations, cover remote stroke diagnosis, and get us into the home for home kidney dialysis. Also, there will be a new bill coming up that will deal specifically with Medicare rural telehealth coverage. Yes, even the rural areas need more telehealth. The coverage that there is spotty. So this bill would cover, for example, all critical access hospitals. We'll start to cover the therapies. We'll allow community health centers, rural clinics to have a network, to be the provider site. Number of other things to increase the coverage in rural areas. Importantly, the legislation has also been reintroduced already on the one state licensure model for Department of Veterans Affairs. These bills are S295, excuse me. Let me do that over again. This bill number is S925 and HR 2123. There will be other bills, I'm sure, introduced that have been in previous Congresses dealing with the Medicare program and TRICARE. Number of other things going on. The Office for the Advancement of Telehealth is getting an additional $1.5 million to create a special telehealth resource center. This is part of the omnibus funding program for the rest of the year for the whole federal government. The Federal Communications Commission is getting active. They have out a request for comment by May 24th about just broadband and telehealth and all kinds of things that can be done in rural areas. One of the issues that has come up is there's been an allotment of $400 million a year for broadband infrastructure for rural areas, and they have hit that amount finally after years and years and years of not getting that money obligated. So they're already at that $400 million allocation, and one of the things that they're trying to do is figure out how to go forward at that cap. Another agency that's busy is the Food and Drug Administration. One of the things is Congress is looking at the user fees that device manufacturers pay and things that the FDA can do to expedite the process and approval of drugs, medical devices. On the state side, lots of activity there. First of all, we'll get more in depth on Thursday, May 25th at 2 o'clock Eastern Time with our monthly state call. You need to pre-register for this so we can send you a link for it. We now have 33 states, 2/3 of the country, that has parity law. Since our last broadcast, North Dakota and Nebraska have joined the list of states that have parity. It is pending in other states, Iowa, Kansas, Massachusetts, New Jersey, North Carolina, and West Virginia. In Indiana, they've just improved, the legislature's taken steps to improve coverage of Medicaid, and we're making progress with the states on joining the licensure compacts. The physician licensure compact has gone live, and they're starting to process applications. The one for physical therapists just had enough states join to reach the threshold that was set by the physical therapy boards to launch their system. So now they're going through the process to do that, and the other compacts are proceeding along. So I need to get back to finding more gophers with more telehealth bills on Capitol Hill. So look forward to seeing you next month with more bills to talk about.
Thank you, Gary. It's a lot going on, and we're going to see you next month when there's even more going on in this month in telemedicine.